What causes wheezing in child bronchiolitis? Imagine tiny airways in a child's lungs that are normally open and easy to breathe through. When a child develops bronchiolitis, these small airways, called bronchioles, become inflamed and swollen. This swelling is mainly caused by a viral infection. The most common virus responsible is the respiratory syncytial virus, but other viruses like parainfluenza, adenovirus, influenza, and human metapneumovirus can also cause bronchiolitis. When these viruses infect the respiratory tract, they spread from the nose and throat down into the bronchioles. The infection causes the lining of these small airways to swell and produce extra mucus. This buildup of swelling and mucus makes the bronchioles narrower than usual. Because the airways are so tiny in infants and young children, even a small amount of swelling or mucus can significantly block airflow. As a result, when the child breathes out, the narrowed airways tend to collapse more easily. This creates a high-pitched whistling sound during breathing, which is called wheezing. Wheezing mostly happens during expiration or breathing out because the airflow pushes against the narrowed, inflamed airways. The physical structure of young children's lungs and airways makes them more prone to this kind of obstruction and wheezing during infections like bronchiolitis. In essence, wheezing in child bronchiolitis is caused by the viral infection leading to inflammation, swelling, and excess mucus in the bronchioles. These changes make the airways smaller, which restricts airflow and causes the characteristic whistling sound. Because children's airways are smaller and more flexible, they are more easily obstructed, making wheezing a common symptom during bronchiolitis episodes. Parents and caregivers should keep an eye on children with bronchiolitis for signs of breathing difficulty. If wheezing worsens or the child has trouble breathing, it is important to seek medical care promptly. Severe cases may need medical intervention to help the child breathe more comfortably and safely. Always remember that each child's experience can be different, so consulting a healthcare professional for personalized advice is essential.